Easter's in full bloom at Whole Foods Market with great deals on spiral cut bone-in ham and leg of lamb, both crowd pleasers. Round out your spread with quiche, deviled eggs, and delicious catering platters from Prepared Foods. Oh, and remember to pick up a Whole Foods Market bunny cake from the bakery. Strapped for time? They cater too, with delicious options available without the effort. Find hundreds of Easter deals and delights now at Whole Foods Market.
Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I'm joined by a guest pediatrician bestie, Dr. Rachel Georgopoulos, who is a pediatric ENT physician and director of the Pediatric Thyroid Hope program at the Cleveland Clinic. She also attended medical school with my husband, so this is a very special episode for me. All right, so today we are going to talk about snoring and sleep apnea. The clock is ticking, so let's get to it. All right, Rachel, I'm interested to hear what you have to say about this topic because my daughter is actually quite a snorer. She'll probably be mortified when she hears this episode, but let's talk about it. So let's say you have a child who snores loudly. Does this mean that they definitely have sleep apnea?
Oh, great question. Not necessarily. So you can snore and not have sleep apnea. I usually tell people that about 30% of people who snore do have sleep apnea. And I know this is going to probably lead into a follow-up question, but I usually say that there are other signs that you want to look for to see if it is sleep apnea or not. Those are choking, gasping, breath holding at night. I usually make some funny noises in the office when I'm seeing patients. Sounds of obstruction. Those are the kinds of things that we're looking for.
Got it. Well, you definitely did already answer my next question. And that was, besides snoring, what are the other sides of sleep apnea? So then how can sleep apnea affect a child's development or behavior?
So untreated sleep apnea, we know from our studies that children can have lower IQ scores. You can imagine that if you're not getting restful sleep at night, it is difficult to focus during the day. There have also been some really good studies that have come out that have shown that there's a proportion of patients who are getting misdiagnosed with things like ADHD who actually have sleep apnea. And so it may seem counterintuitive, but you can actually be hyperactive when you're getting poor sleep as well.
How interesting is that? So how do we, and again, I think you already kind of alluded to this, but how do you actually formally diagnose sleep apnea in children?
So our gold standard is a sleep study. Having said that, I have patients who have a really good history. They're able to tell me they're choking, gasping, breath holding at night, and their physical exam is, will reveal things like big tonsils that can help explain the symptoms of sleep apnea. And so I don't always need to get a sleep study on children, but the sleep study is the gold standard.
So when I think about sleep apnea in adults, I picture that machine, that adults put on their faces. Can we talk about, is that what's done in children? How do we treat or manage sleep apnea in kids?
Yeah, so kids and adults are actually quite different in how we manage sleep apnea. What you're alluding to is that CPAP machine, and that is a treatment for sleep apnea, and it's our first line treatment in adults. But in kids, most of the time, like I said, especially if their physical exam matches the diagnosis of sleep apnea, taking out the tonsils and adenoids is usually our first line approach. And that's because the studies have shown that about 90% of the time it's curative of sleep apnea. Most kids don't wear CPAP, even if we prescribe it. And there anecdotally are just some concerns with mid-face growth with that constant pressure. I do have some kids that have developmental delays or other reasons for sleep apnea, can undergo surgery that we do CPAP on, but it's not as common.
All right. Well, I learned something. We hope you learned something, and we have lots more to share. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.